sudden infant death syndrome. Do you guys know about it? Have you heard about it?
Never heard of it.
Okay.
No.
Well, it is the unexpected and immediate death of an infant less than 1 year old, in which the cause is unknown and even after an investigation. There are many different factors that can lead to SIDS, including genetics, environment, and social culture. So, some immune reactions, stressors, and abnormalities within the body, and then the vulnerability of an infant can lead to SIDS. So, some risks are sleeping on the stomach or a side position, soft sleeping surfaces, if your baby is 2 to 4 months of age, if they're premature, if they're sleeping with some blankets, pillows, or other soft items, overheating or the head being covered, secondhand smoke, alcohol use of parents, and then parents sleeping in the same bed as an infant. Some signs and symptoms, SIDS mainly occurs without any signs and symptoms. It usually occurs in healthy babies, but there are some signs and symptoms that could happen, including changes in breathing. Your baby could start breathing noisy or labored or irregular. They also might have difficulty or changes with feeding. They might have a severe high or low body temperature. They might have a low heart rate, and then decreased or impaired arousal. So you want to remember the ABCs for safe sleep, which include your baby should be sleeping alone without any blankets, pillows, and then on a soft or on a firm mattress, avoid any soft toys. And then they want to be sleeping on their back and not on their side or face. And then you want to have them sleeping in a crib alone. So you should call the doctor if your infant's breathing patterns become irregular or pauses occur with breathing. If your infant's arousal becomes impaired, if you notice any changes or difficulty in their feeding, if their body temperature becomes really high or low, and then if the infant's skin becomes pale or bluish. So in order to prevent SIDS, you want to position infants on their backs to sleep, place infants on a firm surface with a fitted sheet. You want to avoid any loose sheets. Do not smoke or use drugs or drink alcohol. Do not place soft items, blankets, or pillows in the infant's sleeping space. And then breastfeeding has been shown to be protective against SIDS, along with pacifier use. Tummy time has shown to help infants develop and can be protective against SIDS. You want to vaccinate your baby and well baby checks in order to prevent SIDS. And then you do not want to share your bed with your infant. However, it is recommended that you sleep in the same room with them up to 6 months in order to prevent SIDS. Do you guys have any questions?
I do.
Okay.
So I'm a pretty heavy smoker, like 1 pack of cigarettes a day, typically. So should I stop smoking around my baby, you think?
Yeah, and it's recommended to avoid smoking around them and not smoke at all, because even when you smoke and you're not around them and when you're holding them, the smoke can transfer.
Okay.
And it can lead to SIDS. It can also lead to many infections, which can increase the risk of SIDS as well.
I should probably stop the drug and alcohol use as well.
Yes, because that can also increase the risk of SIDS, both in pregnancy, that is not recommended, and then after pregnancy.
Thank you.
You're welcome.
So you said whenever you said alcohol use and parents as a risk, did you mean me drinking alcohol while I was pregnant, or me and my husband drinking while the baby's sleeping?
you're pregnant, you should not be drinking alcohol and then it also isn't recommended when you're after pregnancy and you're like around your baby as well, but definitely not during pregnancy.
That makes sense. Thank you.
You're welcome.
Thank you.
Any more questions?
So I shouldn't have my baby in my bed, right?
Yeah, because that can cause suffocation
My
and
husband's pretty big, so I'm kind of nervous that he'd roll on top of her.
yeah, it is
Yeah.
recommended that they sleep in their own bed, but in the same room as you, because if you do sleep in the same bed, it can lead to them becoming suffocated or entrapped and can lead to SIDS.
I love my baby, so I want them to be protected.
Okay, that's good.
And whenever we talk about tummy time, do you recommend that being like just an everyday thing to do with them?
Yeah, it's best every day, and just make sure that like when you do it, they're awake and they're being supervised.
Okay.
Thank
Thank
you.
You're